With approximately 30% of people living within the Western Trust area who are undiagnosed with dementia, we would encourage everyone to recognise the signs and symptoms of the disease. There are different types of dementia. The most common one that people would know of are memory difficulties. So it might be a bit more forgetfulness about what happened in the last few days, the last week, this morning. Those are things that people can start to notice early on. There might be a few word finding difficulties that people would experience. There can also be difficulties with problem solving. We have a great service, a great team of different staff, including doctors and nurses and occupational therapists and psychologists. And we all have a great understanding and experience of assessing and treating dementia. So there might be a few thoughts that people have about what our service can do, and there might be fears about coming along to our service, fears about the future. There might be a perceived stigma about getting a diagnosis of dementia. We would obviously encourage people to come along if they have any concerns about their difficulties, and what we can offer is a really good comprehensive assessment. Now what that means is if the memory difficulties are thought to be related to something else, such as sleep problems, such as depression or pain, or any other physical conditions, we can then get the appropriate treatment started. There are lots of benefits as well to coming along and getting an early diagnosis of dementia. We have got 2 wonderful dementia navigators within the Trust who are able to meet with someone when they are newly diagnosed, meet with their family and talk about what services are available in the local area. We can offer advice and education about dementia, whether that's in an individual format or whether that's in a group. We can also talk about any local day centres or respite that are available in the area as well. It also gives us an opportunity to talk about any financial benefits that the person who is newly diagnosed or the family caregiver may be entitled to. If you recognise that you have memory difficulties or forgetfulness or difficulties with your thinking, or you think that someone in your family may have memory difficulties, chat to them and then please go to your GP and talk about a referral to our service.